So very good evening. Assalamu alaikum Asghar Bhai, and very glad you are here. So he is Mr. Asghar Khan, and he is aged about 44 years now, and he diagnosed as for the last 1 year before diabetes mellitus, and since he have taken some of the investigation from the company side, that time revealed that there is a HbA1c is a 7.9, and the fasting blood sugar is 108, that is 118 mg per deciliter, and postprandial is 284 mg per deciliter. This was diagnosed that already has been given on the investigation that we have treated from that time in the month of September 2023. So what was the symptom was there, Asghar Bhai, when you came here for the treatment? Why did you come here? What was the issues you got it, and how you came to know that here we will give the treatment without any medicine?
See, I was diagnosed during my regular health checkup that I have diabetes, and it was a shocker. But nevertheless, I have a family background which my father has a diabetes, my uncle had a diabetes. So I was just worried, and then one of our relative recommended to go to you, and that's when I came here and started my medication here. Alhamdulillah, I'm feeling good now. The last test was which we did today was 130 mg, so it looks to be good.
Yeah. In fact, I have started the treatment initially is the weekly once, continuously has given the treatment for the span of 3 months. We have done the treatment, and later now after the nearly 3 months later, we have done the May month he came, then again he is coming on the August month, and it is a long gap, and before that also 3 months gap.
Yeah.
In that way, I normally completed few couple of sittings like 3, 3, 6, 10, and then 15, 16, 17. Maximum till today, 20 sittings were completed for the last 1 year intermittently, isn't it?
Yes.
So in that way, today we have done the investigation that what is the glucometer. We have checked that what is the random blood sugar. How much is it blood sugar
130.
today? 130 mg per deciliter. So this is the result. In fact, I have started giving the treatment since I have seen the pulse diagnosis. That time I found it that the pericardium energy level is partially weak. In that way, I thought the mind constitution somewhere it was emotionally disturbances. Due to that reason, I treated by activating some of the points like a pericardium 3 and then pericardium 7 and the pericardium 6. The Chusa, Darling, Nikwan. These are the points. I just activated 3 points in the first sitting, and further then I found that spleen energy is partially weak. Then further I treated the 3 points. Again there is the pericardium 7 and spleen 3 and then spleen 5 according to this data. In fact, further I just keep doing the same in order to improve the overall metabolism. I think you have good hungry now, and you have good sleep, and
that's
your
correct.
bowel movements are good, and the thought process. By the way, I recommended him along with this treatment, the physical exercises, and also the diet, which is really required as a balancing diet, which is a protein, fat, and carbs. Collectively, that will be really helpful in order to use the raw food and also the cooked food. The overall we understand 20 to 30% is the formula is there. 20 to 30% should be used as a uncooked food, and then nearly 70 to 80% should be eaten as a cooked food.
Okay.
So this should be balanced till our last breath. As the tooth is good and your teeth are really, you can do the mastification very well, and then you need to do the metabolism through the mouth itself. Once you mix it with that saliva, the food that's called as a bolus, which will be also further you feel the good changes in your diabetes as well. And by the way, I treated in between the lungs also. I felt the deficiency, then I activated for the lungs as well. In that way, the balancing method I have completed. So you can see that there are the nearly, before I have seen that mercury, another 111 by 78 millimeter of mercury, then 100 and again 14 by 79 millimeter of mercury, and further it is more or less is the hypertension also 120 by 87. This is the range which I have done the treatment, but really it's the great. But people, we can diagnose the patient what exactly the pulse diagnosis, and based on that we can do the treatment. And further there is the diabetes protocol as well, where we can add up some of the points like a LU7 or LU8, you can use it, and then pericardium 7. Pericardium 7 is the major key point to treat for the diabetes, especially bilaterally or the unilateral. You can use the P7 point. That always is good. That's directly connecting to the pancreas as well. But this is normally what I have started the treatment, especially for type 2 diabetes mellitus. But type 1 is really I don't recommend you, but still we wanted to take the diabetologist opinion. But type 2, without the people who have not started the medication yet, and certainly we can manage with the various natural modalities like acupuncture is a non-drug treatment, and certainly this will be useful for you. And I believe you that I convey this message to you, that is not that today you are normal, but of course this to be maintained less than 150 millimeter mg per deciliter you can maintain. That will be really helpful for your overall health, but
Sure.
for the later future. But
Sure.
please, you is not that you need to come every 3 months or the 6 months, but this is the art how to maintain your blood sugar. But this is what I have given already guidelines to you. Please do proceed that with
Sure, doctor.
emotionally shouldn't get lot of disturbances, and then physical exercises, diet, and then perhaps the 3 months or 6 months once you come here and take the treatment without any
Sure, doctor.
medication, Almighty will give you the great success in the in
Thanks,
your
thanks
life.
for all your help, doctor.
Jazakallah.
Thank you.